Okay, I am back. So can you all see my PowerPoint now that's up and also still hear me? Excellent. Thank you, Anne. And we'll go ahead and get started in just a moment. I'm going to go ahead and put this on slideshow so we can begin. And I am recording this, so it will be posted up on the forum. Usually within a day it's posted up. And if you do have questions, just go ahead and type them in for me. I have quite a bit to cover as usual. I don't seem to be at a lack for things to say about what we do, so that's good. I never run out of things to talk about. But hopefully this will give you a good idea of some of the things to look out for and things with troubleshooting with medications. I think I'll go ahead and get started. It looks like we've got at least 15 people here so far. So welcome. Happy Wednesday. It's always nice to get to the middle of the week. So thank you for coming. And without further ado, I will go ahead and start in about our maneuvering through the mystical land of medications, okay? So I'll start out by saying that it is very, very mind-boggling to deal with medications. You feel like you're almost having to be a doctor, and I totally get that. So hopefully this will help you a bit when we go through this. Let's collect our thoughts, and hopefully this will help you. First of all, you have to kind of come to terms with what are your personal difficulties with medications. Have you ever thought any of these very things? I certainly have myself, and I still work in the real world typing, so I totally get it. But we can just hear ourselves going through these questions. I don't get it. Why is this our responsibility? It's not my fault. I don't understand these things. The doctor's supposed to understand these. They're supposed to be clearer. I try, but I just don't understand how to find these things. How do I figure this out? Generic versus brand name. Why is this so difficult? Again, I'm not a doctor. Why do I have to know medication dosages? The internet has all these spellings, and why can't they be considered acceptable variations? Well, we'll address these things, and the problem with that is that the very title that we hold, the HDS, that means we're a healthcare documentation specialist. So I would call your attention to the word specialist. This means that somebody has high-level skills in certain areas. It means that they're experts. That doesn't mean that we're a doctor, of course, but it does mean that we are supposed to be able to have the skills at our beck and call to resolve questions about medications. The documentation of medication, in my humble opinion, is the most crucial area that we can get things correctly noted. I'll go into that in a bit of detail as we go along. And how do we become experts? Well, it's just like any other skill set. We become better by doing our homework. In some cases, we have to actually become a super sleuth because it's a complex thing. We have to possess those skills that we keep reiterating as instructors, critical thinking skills. How do you decide that something is right, and how do you decide something is wrong? Sometimes by process of elimination, if we can figure out what is wrong in a question on a test, in a question that comes up in a report, if we can figure out what is wrong, we can decide which is the right answer. And that is what critical skill technique is all about. We're actually weighing pros and cons. We're examining something to see if it makes sense. Brand name versus generic names, okay? So a brand is when the U.S. FDA approves a drug for the first time. There's only one manufacturer, and they make and sell the drug under a patent. So these new drugs get to be known by a brand name, and they are referred to as brand name drugs or trade name. I've heard them called that as well. Then the generic side of that, it's a drug that can be produced after the brand name drug's patent has run out. It's also called a generic equivalent by some. And I'm in the U.S., and so a lot of pharmacies will ask us right up front, are you willing to accept generic drugs rather than brand name drugs? And most physicians are okay with that. If the patient chooses that route, they're okay with it because it costs so much less money. Brand name drugs, at least here in the U.S., are exorbitant. They just cost a fortune. There is some stuff out there, information. People say that generics aren't as effective. There are more problems, blah, blah, blah. 99.9% of the people, I think, go with generics just because of cost here in the U.S. If you follow the directions on the drugs label, the generic and the brand name should have the same side effects, or same effects, side effects, and then safety and risks. So here we have an example, lisinopril, and it's going to be known as its brand name Zesteril. But for most of us who take lisinopril, that's the one that we purchase. So what is the big deal with capitalization? Why do we make such a big deal out of it? Why do we get a protocol failure if we do not note correctly a generic versus a brand name drug? It causes confusion, and that is what has been explained to me over the years by many, many companies, many, many facilities that I've worked for on my own with my own transcription service. If we put in a capitalized medication and it was supposed to be a generic drug, they have the idea that perhaps that we have put in the wrong medication altogether. They start thinking about it. They're like, well, that seems like it's the right med, but what if she didn't hear it correctly? Maybe we need to go back and revisit that dictation. Maybe we need to go back and look at the chart. So it costs them time. It costs them money because they have to have somebody go back and check all this information to verify it, and it costs us because it makes them really angry if they find out that we just put in lisinopril with capital L, and he had to go back and figure out if it was Lasix or Lopressor, or the nurse had to go back and look that up. They're not keen on that. They don't like doing work that we're supposed to be able to take care of at the first go around. So that goes back to us being specialists. That goes back to us, knowing what we're doing once and done, that the guy dictated it, the provider dictated it this way, and we knew the difference. We didn't have to make that go back to the physician to spend time on. Okay? So how do we sleuth it out then? Because none of us know these drugs. Some of them we might know from TV. Some of them we might know because we take them. Some we might know because we have family members that take these medications. Or in the old days, you could be like Audrey, who went up to the pharmacy and leaned on the counter and just wrote down medications that I could see on the shelves, waiting for people to pick them up, and I was questioned by pharmacists as to what I was doing. This was obviously before there was internet. It used to drive me crazy that I had to wait so long for drug books to come out, and we didn't have any other resources. So I would just, get into conversations with the pharmacists and say, what's the generic, what's the brand name? And I had a little notebook and sat there and wrote it all down. And then when I had dictations, I was able to more easily avoid leaving blanks because I had done my research. And that was quite labor intensive, obviously. I used to do the same thing with drugs in the supermarkets, in the drugstores, just walk up and down the aisles, write down how things were noted on products that were not in my drug book, just so I would know. Bandages, things like that. I asked hospitals to give me surgical catalogs so I would know like up and coming or new instruments, new things that were on the market that had not made it to the drug book yet. And seriously, it was, you know, a lot of sleuthing because it would take years to get new books from Stedman's. So it was, you know, quite labor intensive. We have to develop those researching skills, and by researching skills, I mean accurate researching skills. Just because we find it on the internet, it is not necessarily so. So we have to know the difference. We really don't have an excuse. There is no excuse. I can tell you that if I put in a wrong drug or I misspell a drug, my supervisor would jump all over me and say, is there a reason you couldn't look that up, Audrey? Really? With all the resources we have today, drugs.com, RxList, FDA websites, you really had to spell that the wrong way? And it is a personal thing. It's, you know, I would rather die than have somebody get mad at me for not taking the time to do it correctly. So I'm very, very conscientious about that. And if I have any questions whatsoever, I'm always going to flag it for them because I don't want to be that person who just said, well, I think that's right. I'm pretty sure that's right, but you know, I'm not sure that's right. So I always do what I'm supposed to do, especially when it comes to medications. That's a really sensitive area. There are no shortcuts. If you say to them, I looked it up on the internet and that's how it was spelled, you better have a website that you look that up on, and it better be a good one, like drugs.com, or if it's rxlist.com, something like that. If we use the excuse that we looked it up on the internet, it does make us appear less intelligent, because if we spelled it incorrectly, like I say, there are so many different ways that people spell things on the internet, and it just does not make it so. It doesn't mean it's right. And it makes us appear lazy. I'm not sure which one I would want to be called, less intelligent or lazy, or both. I would be personally offended if I felt that I did not do my job and look those up and be totally sure of what I put in that report. We do have to justify and defend if needed. If somebody does come to you and say, where did you document that? You better have an answer, because they will come to you and ask you that if you make mistakes, and if you make mistakes especially on a consistent basis, they will come after you about it. Drugs.com is simply, in my humble opinion, the best place to be. RxList is very, very similar. I just personally like drugs.com, and I use it every day on my job. I also play games online where, or on my phone, where I have generics and I have brand names, and I have to decide which generic means the equivalent in what brand name. Things like that help me as you know, an older transcriptionist, but I'm always searching for just developing my knowledge anyway. I like being able to test myself and see how good I think I am, and then actually how good I am, in the final process of it. So I like to quiz myself. I like to keep on top of little brain games like that, especially where drugs are concerned. So I download apps and I work on this kind of stuff when I'm standing in line or have to wait for something, because that's a pet peeve of mine. I don't like wasting time. So to me, this is education, and it's continuing on all levels because there's always new drugs and I can always have new games. Anyway, we can become geniuses by using this simply because our chances of getting this incorrectly noted then precipitously go down because we've done our research. You can research as it's showing you here with the screenshot, A to Z. If you happen to know the beginning letter, you're pretty sure about it. So it's giving us some trending searches there. If you're stuck, you're like prednisone, okay, awesome. I got to figure out if that's generic or it's going to be brand name. And I will tell you right there, where it says trending searches, that's a really big hint for you right there. Every single one of those drugs are generic because they are in lowercase. So that's one way of beefing up your vocabulary. And another thing too, just the fact that you visualize these drugs, just the fact that you stop for a moment and you say to yourself, gabapentin, amlodipine, lisinopril, tramadol, prednisone. You have helped your ear, you have helped your brain, you have embedded that into your psyche somewhere. So when you hear those, you might just be able to hear them better, even if you didn't hear the whole thing. I'm just going to check here because I see, okay, what are the games you're playing? I will answer all your questions at the end. I just go on my phone to the app store, the app thing, Google Play Store, whatever it's called. Sorry, I'm brain dead this morning. And I just Google things like drug match games, things like that. So anyway, perdrugs.com, how do we figure out if it's generic or brand name? So when we type that in, this is what's going to come up with this little star, okay? It's going to tell us a little bit about it. It's going to show us that it's an ACE inhibitor, which is kind of nice because now we've embedded in our brain that ACE inhibitor, it's all caps. That's a really good thing. And it also means angiotensin converting enzyme, which is good to know, in case you got asked that. Yes, on the street. It happens to me all the time. Not so much. But it is kind of, it embeds again in your brain that, oh, that's what ACE stands for. And I like that. I like resolving those types of things. I don't have to ask them the next time, what does ACE stand for? But it would lead you to believe that perhaps that's a brand name drug because it's capitalized and it has a star. Would we assume that? No, we would not. So the reason why is we have to go a little bit further. So when we look at that, the star does not mean that it's generic. The star does not mean that it's a brand name. It's just letting us know that it was an editor's pick. And the reason I think it was an editor's pick is because it's probably one of the most heavily prescribed medications on the market today for blood pressure and other things. It's also used to treat CHF, and as you can see, it improves survival after a heart attack. So when you click on the lisinopril, now we get to the meat of it. So always click one more page in when you're using these to verify. That's my best advice to you. And you're going to see there, right in big letters, generic name, lisinopril. And then you're going to see that the brand names are those that are listed, amongst others usually. It's used to treat, again, high blood pressure. It's used for congestive heart failure and things like that. So if you'll notice as well, you're going to be able to look on the tab for dosages. This is super, super important. So you see that it's in 2.5, 5, 10, 20, 40, 30, and then the very last one is 1 mg per ml. And that is going to be an IV dose. So if you heard somebody dictate lisinopril 1 milligram, you would probably flag that unless the patient was in the hospital and it was being administered because they had severe hypertension or malignant hypertension. So you can use these tabs to look at the overview of the medication. Then you can also look at the dosage. And it only takes a minute. It's just not that labor intensive for you to do this. So always make sure you know this, that these pages are here for you. That's how you're going to be able to do your accurate research. If you scroll down on that main page where it said lisinopril was generic, pardon me, it's going to even tell you what the usual doses are. 10 milligrams orally once a day, 5 milligrams orally, blah, blah, blah. Maintenance dose, it can go up to 20 to 40, things like that. So there are all kinds of different ways that we can verify what we're hearing and make sure that we do not look stupid when we're doing these reports. I do have something to point out, though, because it just came up yesterday. Somebody was asking me about Lopressor. So the student went on there and apparently somehow mistakenly looked at Lopressor HCT, but actually the question was about low pressure. That's the other thing. We have to be cognizant of what did they say. We don't want to overthink either. We want to be good at what we do. We want to be careful about, doing due diligence, but we certainly do not want to overthink. We don't want to assign a medication that was not asked about or dictated. So if Lopressor is dictated, that means plain old generic Lopressor. If Lopressor HCT is dictated, then that is a combination drug much like Benicar HCT, and it contains hydrochlorothiazide as well as that metoprolol, or whatever Benicar's generic is, which escapes me at this very moment. I think it's olmesartan. But another way you can check yourself, if you just Google lisinopril, okay, you didn't even go to drugs.com, you just wanted to see what you got right away, type it in Google. Okay, this little window pops up in my Chrome anyway. It says lisinopril, and it says common brands. So this leads me to believe that this is generic, and then if I had any doubt, I was going to go to drugs.com and look right here to see and verify that. You can also listen to this if you want. It has a pronunciation guide, but almost every drug that I type in, that's the first thing that I do is hit it on Chrome, and this little box comes up and tells me what it is. And then if I have any further research I need to do, I can go to drugs.com or another drug website and research it further, so I have no doubt that I have done that research and it's accurate. When you can't hear all of it, drugs.com has this great thing called phonetic and wildcard search. So the website, and all of these, by the way, that are underlined, there will be a PDF that gets uploaded with the recording for today. And if you click on that, it takes you right to the wildcard and phonetic HTML site. And you can save that in your favorites, of course, so you don't have to keep looking for that. And then the next time you get something, you're like, okay, he said Xanax. How does that sound? And you just type it in however you think that sounds. And I see this all the time, Xanax, and somebody gets, you know, a 1.5 misspelling error. It took 2 seconds to go here and type this in, and here it is right here in front of me. And it's showing that it's a brand name drug. So the excuse of I don't know where to look or I don't have time to do that, it takes me so long to do these dictations, it's not going to hold any weight in the workplace, and it should not hold any weight during your curriculum, simply because we are creatures of habit, and if we get into the habit of not looking things up and thinking, oh, it's pretty close, I'll look at it when I get it back. Bad news, because you're not learning then at the rate that you could possibly learn at. So even at my advanced age and expertise level, if I, for 1 second, am not 100% positive, it happened to me just yesterday, I thought, you know, I'm pretty sure that's right. I'm pretty sure, like 99% sure that's right. And I was going to go on, and I couldn't do it. I just could not do it. If it enters my head for 1/10 of a nanosecond that I could be wrong, I'm going to go look it up. And I did, and I was wrong. So it really does pay off. Those my last evaluation was 100% accuracy, and I treasure that. I do, more than jewelry. I think of that as the ultimate gift, that I have done my job, and I really, really, really try to just make sure I do my research so I don't get called out on not doing it. And it's not that none of us make mistakes. We do. We make small word errors. We do things like that. But when it comes to things like this that are so important, to me, it's the pinnacle of my career that I get those things correctly noted, and I get 100% score for that. So if we just type in a prefix or a suffix, all we're hearing is prill. All we have to do is add an asterisk. So this will bring up more prills than you can shake a stick at. So you've got lisinopril, enalapril, ramipril, captopril, I can't say it, periodinapril, whatever, benazepril, quinapril. So, and much more was below that. I couldn't capture it. So then you go back, you have this open, and you go back and you listen, and you go, okay, is he saying lisinopril? Is he saying enalapril? Is he saying captopril? And if you honestly can't make it out, underscores, 5 underlines, 1, 2, 3, 4, 5, space, parentheses, lisinopril. And then at least you've done that, at least you've looked at this. But hey, while you're here, you might as well add those other medications, and just note that they are probably going to be treating blood pressure, because all those drugs that end in pril usually are antihypertensive meds. So it's not a loss, even if you can't fill in that blank, even if you can't get it 100%, you're not sure, you still have learned something, and a lot. Okay? You do see a lot on the drugs.com site. You can search by medical conditions, and I have done that before. I have gone through, especially if it's a really weird condition and the medication is something that's not just normal, that I don't hear all the time. And I'm like, I just can't believe this. I can't hear it. And so I'll go to the condition, and sure enough, maybe it's one of those 5 really crazy medications that are used for that thing. And I'm like, wow, I'm really glad that I took the time just to look that up, because it worked. And again, couple minutes. You can also search for herbs and supplements. Sometimes I used to do an account that had so many supplements that I had to go on. I actually bought a book, this was again before the internet, of supplements and herbs, because I was forever not being able to find these in the dictionary. So I just bought a supplemental book to look through, and it really saved my life. And they were like totally amazed. I can't believe you're nailing these. And I said, well, they are kind of like drugs, but they're not. But I like how drugs.com, and I think maybe RxList does the same thing. They do list those as well, so you can find them, because a lot of people are on these nowadays, and 9 out of 10 times those herbs or things like black cohosh, things like that, they're going to be lowercase or generics, but a lot of times people take these, they don't even have a prescription for them, or they're not told to take them, but they start taking them. So in my experience in current time, there are a lot of them listed in patient histories and medication lists, and they do have to know about the supplements that the patients are taking, because it can affect their blood pressure, etc. You can also scroll through the top 100 drugs on the market, and those come up more often than Carter has pills, literally. So you can search by the first letter, like all the drugs under I, or you can kind of consolidate that down, and if you're just hearing IB or in, you can search that way as well. So that's pretty cool. Excuse me. And this is, oh, they do. I was right. Okay, so RxList does have a vitamins and supplements webpage. Awesome. And it is much like drugs.com. And as you can see, you can look up all of yours, alphabetically as well. I'm just not as familiar, just because I use drugs.com. It's just been my go-to. So when you're looking at medical conditions, he maybe has high cholesterol, but you can't make out the med. You're like, I can't hear it. So just by going to that medical condition and looking up cholesterol meds for high cholesterol, you will, again, get a freebie. Common statin examples include, and there you get a whole bunch of meds. You can add those to your word list. Another one that comes up a bunch now is the PCSK9 inhibitors. So you definitely want to look at those. Repatha is the most common, and Praluent. So it just helps us. It's a learning nugget. Even if you didn't use one of these, and look at what else you got there. They're known as HMG CoA reductase inhibitors. So bring that up at a cocktail party. Wow. Anyway, it's just, and I make fun, but really every time we learn something, it's food for the brain, and it will come back. It's never wasted. It's always going to be there for us. Another interesting thing to think about is when we're doing these reports, we have to stop and ask ourselves, what is this report actually about? Okay, this guy came in, he's 67 years old, and he's got all these medical problems, and we have to remember all that stuff from the beginning to the end of the report. So we get down to the end, and they're going to change his medication for cholesterol, so we just kind of look back at the beginning of the report, see what he was on maybe, and if they're changing him, it can't be the same drug, so we're going to have to go and find another drug if we can't hear it. Things like that. We have to stay engaged for the whole report. And I have noticed in my own experience, sometimes when I have to leave a blank at the beginning of a report, I'm really ticked anyway, because I don't like leaving blanks. I'm supposed to be good at this, right? But sometimes we just can't hear it. So then by the time I get to the end, chances are somebody has redictated what I missed up at the top. And so if I wasn't paying attention, which I do know some people do not, they've reiterated it. And I'm like, wow, was that lucky or what? I got that blank. So then I can go back up and fill it in. But that is part of what we do. We have to keep thinking that whole time we're on that report, beginning to end, and it has to be about what that report was about. So this is very difficult for me personally because sometimes I just can't hear 15 or 50. So there's only one solution. I have to look it up. And it's the way they enunciate, or it is my own individual ear. I mean, it's just a matter of I can't get it. It's like it sounded like 50, but it should be 15. So I go and I look it up. It's just not worth making a mistake to me. I can't tell you how many times I've heard meloxicam 50 milligrams, and I know it's 15. So it's like now I know that, so I automatically change it. But at the beginning, I had to keep going back and looking it up or adding it on my word expander so I wouldn't miss it. So, but just over time, we get better and better at realizing what dosages these medications come in. There are some we can get really lucky that are 0.4, or there's some unique thing like 0.625, or maybe they have a microgram dosage. So those to me are easier to pick out just because I know, okay, Flomax or tamsulosin is going to be 0.4 or estrogen is going to be 0.625. And that really helps me out so I don't have to worry about it. But just let's have a little shot at these. If you heard a dosage of 0.4 milligrams, you might be able to pick that out if you knew that Flomax or tamsulosin came in that dosage. A dosage of 37.5 versus 25, it might be diazide, triamptorine hydrochlorothiazide. And I might point out there, too, at the end, the HCTZ, which is a dangerous abbreviation, and we never put that in. We expand it. It usually comes in 25 milligram increments. So that's how we can know that, or 12.5, things like that. So that's how we would know that a dosage was wrong if they dictated, for instance, 2540 for Benicar. Okay, that's how we get to know those things. 88 micrograms. It's going to be Synthroid, probably, levothyroxine, and a dosage of 0.625 is going to be Premarin, or conjugated estrogen. So we start to associate some of that. We do have to remember that things can be catastrophic if the dosage is incorrect. In that very first section of one of the chapters where we talk about the dosage of 8 units of Lantus, and the lady was given 80 units, and it resulted in $1 million, many $1-million lawsuit because it killed her. Nobody noticed. And 8 units of Lantus insulin is quite different from 8 units of Lantus insulin. So we do have to be very, very aware of dosages. Why can't they just speak clearly? That's the question of the century. It's not what happens. They're in a hurry. They're speaking usually quite quickly, especially when they hit medications, which makes no sense whatsoever, but it is what it is. They're speaking in a room full of people. Sometimes we can't hear anything. So if we heard low pressure 15 milligrams, if we take 1 second to look that up on Google, it says right here on Chrome, the intravenous dose is 15 milligrams. That would be incorrect. Who's going to be having an intravenous dose if they're, just a clinic note? So we're going to see immediately low pressure 50 milligrams. And we're going to know that we heard that incorrectly. And if in doubt, we're going to go and look that up. Okay? We trust our dictators to know stuff, but they're only human. And the standard rule in the industry, trust No one. If they spell something for you, you don't have to do it. If they give you a wrong dosage, you don't have to do it. You can flag it, or if it's spelled incorrectly, you can change the spelling, because that's what we do to help them not look stupid and or make a mistake in a record. Okay. A combination medication should be noted with a virgule rather than a comma, because that implies that it's two different drugs, when in fact it's one pill. So that's why we use a virgule. We also do that for the dosage. And there are several reports that you probably have noticed, 25-40. It should be 40-25. So you should do, again, best practice, 5 underscores, space. That space is very important. Then in parentheses, put in the dose they dictated, or you put in the correct dose but put it in the parentheses, so that you are flagging that for someone to verify. And Benicar HCT, that confuses a lot of people. The HCT part is on the dangerous abbreviations list. However, it is part of the name. It's a brand name drug. Benicar HCT, which implies that it's a combination drug, and it implies that it contains the olmesartan, and it also contains hydrochlorothiazide. But we leave the HCT in this case because it is the brand name. And if you look there on the bottom line, brand name, HCT. So we leave it that way. So that should help, I hope. And then we have our Bazinga moments. We know not to expand it in that case, and we also know how to recognize the dosage, because the HCT is going to be at the end of the dosage, and that will be 12.5, 25, or 25. Okay, so generic versus brand name, important. Dosages matter. If in doubt, flag it. Putting in the wrong medications or dosages will be a career killer. It will get you into trouble. Always check what your report is about. Use your critical thinking skills to match the history with the medications given, and listen carefully when you have dosage sound-alikes and verify them. Now, some grammar points on this subject. So numbers together, Latin abbreviations, differences in abbreviations, and I'll show you all these. Dangerous abbreviations, trailing and leading zeros, and where do I expand and where? Okay, so these are examples. Numbers together, Tylenol number 3. That's the name of a medication, so we leave the 3 as dictated. We change the 1 instead of a number to ONE to make that easier to read and not misinterpret it as 31. Okay? Latin abbreviations leave as BID, PRN. As soon as people find out about the dangerous abbreviations, I notice that they start expanding everything. There's just no reason for it. Leave them as dictated if they are not on the list, okay? And leave a space if you have PO, then BID. So you need a space between P period O period space, then PRN. Because they're each individual Latin abbreviations, so they're not run together like they're one, all right? Then we have, to confuse it further, we have some that are joined after all, QAM, but Q period space day, but Q period for -6 space H. So you have to just individually look at those and decide, the easiest way for me is to have them in my word expander, so I never get them wrong. All right? Dangerous abbreviations, the main ones that come to mind, QD, QHS, and HS. They always have to be expanded. Okay? The trailing and leading zeros confuse everybody. He dictates 3.0 centimeters or 3.0 centimeters or 0.4 milligrams. So everybody leaves off the 0 because they read the part where it says no, do not add a trailing 0. That only applies to a medication. So if he says something is 3.0 centimeters, we leave it exactly as dictated. The hematocrit was 15.0. We leave as dictated. We add a leading 0 to 0.4 milligrams, so it's not read as 4 milligrams, which would be a disaster. That's just the difference. We do add zeros because of clarity and a level of preciseness. 15.0 hematocrit is lower than 15.7, so that's why they do that. You don't add it if it isn't dictated, except in the case of a medication of less than 1. You would add it if he said 0.4, but in the case of 3.0 centimeters, you add the 0 if it's dictated. If he said 3 centimeters, you leave it alone. But if he said 3.0, you add it. The difference in QD and QD. QD is an E sound. QD is an A sound. QD is not on the dangerous abbreviation list, so we leave it alone. Okay? We just don't do anything to mess with that one. The myth, we should expand all abbreviations. Nope. We should expand all Latin abbreviations. Nope. We do not add any trailing zeros. Nope. We expand every abbreviation with a Q. Double no. We use the word to in all ranges. No. Verbatim trumps all. Unless there's an exception, like the dangerous abbreviations, only those we are told to expand on that list are expanded. We do add the trailing zeros, except to medication doses. Q is not expanded with Q day or Q month, etc. We use hyphens for dosages, Q 4 to 6 hours for clarity. There isn't any reason to put the word TO there. Okay? We don't join the MG to the 100. We do join QAM and QPM. We do not join Q day. It has a space. The Q 4 to 6 hours or Q 4 to 6H does not have a space. And Darvocet N100 1 to 2, we end up leaving the 100 because that's the actual dose. And then we're going to change the dosing, which is 1, or we can write out the word ONE to 2, and we could spell that out or leave it as a 2. But it just comes down to, in that case, figuring out what is the most important thing, okay? So if you type it in Google, it will appear, okay? As soon as you type that in, you're led to, okay, glipizide, let me listen. That's it, bingo. Okay, you type in metformin, you find out that it's generic. You type in hydrochloride, you get, wow, I guess that's it. You type in Pravachol, wow, okay. Prilosec, okay. You type in aspirin, there you go. And by the way, both are acceptable for aspirin because there are in Canada some brands that are brand name aspirin. Just FYI. So we don't mark off for that. Again, Google's your friend. Pravastatin, that's the generic, and your brand name is going to be Pravachol. Google is our friend, but of course, that's very funny. My phone just picked that up. Oh my goodness. So use Google wisely, but it is your friend. Okay, so the other somber questions. Why is all this so important? Medical records are meant to be read quickly, and sometimes they have to be read without anybody being there to stand up for the patient. That is the rub of it. Nobody's there to verify things, or the patient's unconscious. The Joint Commission, and other agencies conduct audits regularly on a yearly basis of facilities. They track patient care, and they track mishaps due to incorrect documentation. The Book of Style, which we all hate so much, is based upon the AMA Manual of Style, actually. So AHDI did not come up with all these rules just, sitting around the coffee table and going, I wonder how we can screw these people up and make them remember all this stuff. It really is based on studies, and it is to protect casualties in the workplace, in medicine, and also for patient safety. So who do we ultimately work for? Your mom, your child, yourself, all of us. I would not want something wrong on my child's chart. I actually will give you a short example. My son is legally blind and has several birth defects. He had a pediatrician, and I was going to have to take him to a specialist in Seattle, so I asked for his records. When I got the records, they were so despicable. I had a conniption. I said, I will not stay in a practice that has medical records with this kind of garbage. It was, misspelled words, incorrect capitalization, and his excuse was, this transcriptionist is so affordable that I go with her. And I said, well, you just lost a patient because I won't have records like this. This is embarrassing. And I actually went home and retyped some of them myself. But another example, they had the wrong side listed on his kidney, which was extremely important. So you have to be aware, we all have to be aware of our own records, our children's records, our parents' records when they get to be that age. It's very important, and I stress that to all my friends and family, that they need to be aware of what's in their own records and those that they care about. As MTs, HDSs, I love this. AHDI did this several years ago. We are guardians of medical records, and I take that extremely seriously. Just because of the situations that I've seen come up, things that I wish somebody had paid attention to, like in my mom's records or something like that. I just can't emphasize enough that we are a safety net in some of these cases. On a daily basis, I get wrong work types, wrong patients, wrong med doses, and I know that the doctor meant to say this, but he did not say it. He said something else, another drug, and I flag it, and I get kudos all the time for bringing that to somebody's attention, because so many people would just fly by it and leave it. And I think that what I do is extremely important, and especially where medications and allergies are concerned. In my own record, I never left the practice. My doctor simply moved, and I was switched to another doctor, and when she read off my record to me, just the highlights, mind you, there were 8 errors. I was not a happy camper. So you can also visit the ISMP website, and they have a list of drug names that sometimes get confused, and it is gigantic. But again, just looking at these can give you a ton of information. If you go to this website down here at the bottom, myuhc.com, you can download this PDF, and all these medications are listed as of 2019. The only thing I'm going to caution you about, you will see every single medication on here is capitalized. The only way you're going to know that you have a brand name is they're bolded. Okay, but these are all, so that means terbinafine, acyclovir, all those, famciclovir, all those are generics, but this is a great resource, and I send it to a lot of students. Okay, so I know I'm going to run out of time. I'm so sorry. If you do have questions, though, email me. My email is akirchner@canscribe.com, or hit us at instructors@canscribe.com, and I'm happy to answer anything that I didn't get to if I don't finish. This, they say that it's far more efficient to open your account specifics or drug lists or any other resources rather than having a printed copy beside you. And I know that a lot of us like books. I do. I have the book of style in book form. I used to print out my account specifics, and to tell you the truth, I missed stuff. I did, because I was trying to find what page it was on, where it was highlighted. I have found the most efficient thing, especially when I go between so many accounts every day on my job, I open the account specifics and do Control F, find, to look for date format, to look for cranial nerves, to look for everything. And it has increased my accuracy tremendously. Okay? My solution is to add things to word expanders, because it's not possible for you to mess up if you do this. Okay, so you hear BID, you type in the word in your, you've added it to your expander, you type BID in your report, it expands to BID, you know that that's correct. You hear QHS, you type it in, it expands immediately to nightly, so now you know you were supposed to expand it. It's just a little help. If I add these things, I do not have to keep going back and back and back and back and researching. Although researching is good, it imprints it on your brain further, it's helping you remember, it is a waste of your time. And the problem is, eventually, sometimes you might just go, wow, I'm really in a hurry and I'm not going to look that up. I'm pretty sure that's right. The word expander will save you. I do think that we have to remember a couple of things. We always expand dangerous abbreviations anywhere in a report. We do not expand Latin abbreviations anywhere in a report unless they are on the dangerous abbreviations. Meds and dosages are not medical conditions, so we would never expand them anywhere in the report. The only time we expand medical conditions is under impression, assessment, or diagnoses. So if they're dictated CHF, you leave it. In the regular part of the report, you expand it under impression. But you don't have any reason to expand BID or, you know, anything else other than QHS, QD, or HS, things like that. But it really can help you to nail those dangerous abbreviations if you put them in your word expander. If you look up a med once, you should not have to look it up again, at least for the spelling or even the dosage. If you add this to your word expander, like if you put in LIS for lisinopril, and then you put in the description somewhere in there, you know, 10, 20 milligrams, whatever, you're going to have a sense of what it should be. And then you put in the brand name for it, Prinavil. You're never going to have to go and look that up again on how to spell it. I don't think sometimes we understand how many points we can possibly lose on medication errors. So this would be a self-graded report, and it was from the example that I was showing you folks. All these things, one is a protocol because it's generic versus brand name, one is misspelled. Genuity is critical because you're left out of real medication. Lexapro is critical because it's the wrong medication completely. Methadone, same reason. BIB is critical because we don't really know what the real dosage was. We could think it was BID, but we can't take a chance with that. KCL would be the least one, which would be a formatting error, and Privosec would be another critical. So the person would end up with a shame. 18.5 points off for one paragraph. So, and in the workplace, that would not cut the mustard. I will tell you that right now. that would be a real problem. So we always have to stay engaged, do our homework. If in doubt, leave a blank and a guess. And I believe that's it. Oh my goodness. I barely made it through. I'm so sorry. If I've missed your questions, let me see. You get the word expanders around the Pi 1. There are also some online that you can download free trials. I use Instant Text because it has dictionaries built in. It also has a dictionary just for drugs. And then I merged the medical dictionary and the drug dictionary, which took about 1 second. Lisa's asking if they dictated hydrochlorothiazide first in a combo drug. It would then be the 25 or 12.5 first, probably, but that seems unusual, to be honest. And if you mean in the dosage, if they dictated the drug and then they said 25-40, that's wrong. It should be 40-25. So I would make sure that you flag that right. So it's better to flag, exactly. Yeah, you wouldn't want to switch that. No, you wouldn't want to switch the drug around because that would be highly unusual to call it hydrochlorothiazide olmesartan. Right. There are a couple errors in the QL, the Quick Look Drug Book we know about, Tessalon pearls, milk of magnesia. And again, milk of magnesia is one of those weird ones where I think it can be the brand and then it can also be a generic. But go by your drugs.com if you are in doubt. And then if you flag it and just put it a space and then put it in parentheses, you'll never be marked off for it. So, and do just really concentrate on these drugs, and it will get better just with time, because the more you hear them, it becomes part of your fund of knowledge, you know. And it's like even when I play the phone app game and I'm like, oh, I know that one, and then I get all excited and then I get to the next one, I'm like, oh darn, I don't know that one because it hasn't been around for that long. And the whole thing is, over time I will know that one. I will know it as soon as I see it, and I'll know the generic. And it's not a big deal. All I have to do is look it up, but it just helps me not have to look it up if I continually imprint these things on my brain, and I kind of just play around with. That's my homework, kind of, I guess you could say. It's just different apps. You can look up generic versus brand name match games, and then you just match them. Or you can go online and you can do even you can Google things like hangman games for drugs. They're nursing games, and a lot of people do this because it helps them just commit things to memory without really like opening a book and, you know, getting right into study mode. So you're kind of just fooling around, and there's no penalties associated with it. You're just having fun, right? So it's just an easy way, I think, to kick back and learn. So you can never stop learning enough, in my humble opinion. But thank you all for coming, and this will be posted up. Thank you so much, you guys. And I'm sorry I had to go so fast and I didn't have much time for questions, but it will be posted up, and you will have available the PDF of this. So lots of great links on there. Have a wonderful day, and thank you again, and keep up the good work. We know how hard you work. All right. Bye.